Hi, good morning everyone. My name is Siti Asma binti Muhammad Azhar. My matriculation number is 9107280251080001. I'm learning center from the IUM Sabang Jaya Penang. Today I would like to present about the topic in based on my assignment in research methodology. So first of all is my title in actually in the research proposal is a impact of nurse staffing ratio on patient safety and care quality in hospital setting. So we will go through the table content. The first one is an introduction. Secondly is literature review. Because the third is chapter 1 is included the introduction, research question and significance of the study. And in the fourth one is chapter 2 is included literature review and nurse staffing and care quality and also conditionality conditionality and trait to validity, and goes to the first fifth is the methodology, and we cover up with the study design, study setting, sampling, data collection, ethical consideration and data analysis plan, and we go to the result and conclusion and also references. So the first one is introduction. Actually, the key of element healthcare system in the nurse staffing ratio has a direct and significant impact on nursing practice and patient outcome also. So the number of patients assigned to the each nurse during a given nurse shift is known as the nurse to patient ratio. So research has repeatedly demonstrated that one of the main factors influencing the standard of care in hospital setting is staffing level, while inadequate staffing can result in mistake, exhaustion, and decreased patient safety, and adequate staffing ratio allow nurses to deliver prompt and complete the treatment. So in addition to coordinating treatment plan, giving emotional and psychological support and monitoring patient condition, nurses are at the forefront of the patient care. However, when staffing ratio are too low, nurses are overworked, exhausted and less able to successfully handling a large number of patients. So in a negative effect include the perception mistake and postponed treatment, patient for an increased rate of hospital-acquired infections. So it goes to the problem statement of the study. So in the all the unit like ICU, emergency department, and medical critical ward are among the high demand unit where hospitals still struggle to optimize nurse staffing ratio, despite the mounting evident leaking nurse staffing to improve patient outcomes. So a lack of standardized rules of the figure up the optimal nurse to patient ratio, budgetary restriction and shortage of nurse all contribute to this issue. So the main issue is the insufficient nurse staffing result in avoidable adverse events such as a medication error, delaying diagnosis and patient injuries which directly affect patient safety. So at the same time, inadequate staffing lead to the high turnover rate, job discontent and nursing burnout, all of which has an impact of the general standard of care in the workplace. So nursing professional is gravely concerned about the since the manpower of more difficult for nurses to carry out their duty of protecting patient health. So we go to the research question. The first question is what is the impact of the nurse staffing ratio on a patient safety and care quality in hospital setting? So the overall goal is to look into how nurse staffing ratio is impact patient safety and the standard of care given in hospital environment. So we go to the assessing how nurse staffing ratio affect patient safety outcome such as medication error, patient's fall and hospital acquired infection. These are the one that the particular objective to assess the effect of the nursing staffing ratio on hospital care quality and patient satisfaction, to assess how nurse staffing ratio affect nurses retention rates and also exhaustion and job satisfaction. So we are avoid the different in patient outcome across the hospital with adequate nurse and nurse staffing and those with the inadequate staffing. So this study is actually important because it have the potential to influence healthcare policy and nursing practice. It's said to provide vital evidence about the crucial role of nurse staffing ratio in boosting patient safety and care quality, while also improving nurse satisfaction and retention. So this result will be useful in number of ways. So first of all, the project will be provide hospital administrator with a hard data hard data of that department, effect of staffing level of patient outcome or operational effectiveness. So hospital administration can make well-informed judgment to improve staffing practice, improving patient safety and quality, and lowering preventable adverse events by determining the idealness staffing ratio. Secondly, related to nurses is the study will highlight the importance of adequate staffing in reducing nurse burnout, improving job satisfaction, and promoting nurse retention. Nurses who are not overburdened by high patient to the nurses ratio are better able to perform their duty, thus ensuring a high quality care and reducing the risk of the mistake that can harm patients. So thirdly, for the policy makers, is the research could lead to the evidence-based policy recommendation for regulating nurse staffing levels by advocating for minimum staffing requirements. Policy makers can make help to ensure a safer, more efficient healthcare system. Fourth, the study will be used indicators like error and infection rates, patient falls, and quality of care. They also determined by patients' satisfaction survey. So to quantify the direct effect of the nurse staffing ratio on the patient safety. Additionally, it will be used standardized scale to evaluate nurse outcomes such as burnout and job satisfaction. These quantifiable result will be give to the healthcare system purchase useful and information. Fifth, a reasonable and proper method to elevate job satisfaction and burnout. So the study will be employ a mixed method approach that combine quantitative survey of the nursing staff and also qualitative data analysis of patient safety indicator and staffing levels. This approach that study is in the line with the goal of the investigation. So finally, by providing insight that may result in practical adjustment to hospital staffing policies and procedure, this study will add to the large corpus of knowledge in nursing and healthcare administration. So in addition to enhancing patient care, this study could improve nurses booking condition and increase the sustainability and efficiency of the healthcare system as a whole by increasing staffing ratios. In the literature review, actually a lot of the research has been done in the last few decades on the connection between nurse staffing ratio and patient safety and quality. According to the research, there is a broad agreement that enough nurse staffing is essential to guaranteeing patient safety and high quality nursing care. So divergence viewpoints exist. Meanwhile, on the idealness to patient ratio, the variables affecting staffing choice and the intricate connection among staffing level, patient outcome, and nurse well-being. So inadequate nurse staffing ratios has been directly linked to a rise in the unfavorable patient outcome. According to the numerous research in the ICANN et al. In 2002, they found is the greatest incidence of the hospital-acquired infection is a post-operation operative complication and patient mortality are linked to the lower nurse to patient ratios. Additionally, according to the Needleman 2002, noted that the chance of avoidable adverse events like a medication error or patient fall rises by 7% for every extra patient allocated to a nurse. Nurses' capacity to properly monitor patient is hampered by understaffing, which results in less individualized care and delays in urgent intervention. According to the data, a ratio of 4 to 1 of the grade ratio 1 or greater in likelihood of avoidable mistake and unfavorable result. So it goes to the conditionality and threat to validity. So the association between nurse and staffing ratio and patient outcome is generally supported by the research. However, some studies warn that it is not always clear-cut. The effect of the nurse staffing on the outcome can be mitigated by variables like patient equity, organizational support system, and hospital type, either private or as a public. For instance, the detrimental consequences of the insufficient staffing may be lessened in hospital with sophisticated care regimes or extensive technological support. According to the channel 2017, as different hospitals face a different staffing related to difficulties, contact is a crucial when analyzing the effect of the staffing ratios. Furthermore, some research highlight the danger that methodological flaw pose to the validity. Many studies use a cross-sectional data, which makes it challenging to determine causal link between the staffing level and patient outcome, as noted by Gori and Bakar on the 2019. Furthermore, research on the nurse staffing frequently overlook the diverse character of hospital, which might result in bias or contradictory findings according to the Tang or 2000 on the 2018. A further study must thus take account for the link factor into the consideration and employ longitudinal design in order to gain an understanding of the causal relation between nurses staffing and also patient outcome. So we go to make a conceptual framework. So we are doing the Donner-Bedens model of the quality of care and the job demand resources model serve as a foundation for this study and the conceptual framework. So mainly they will assist in highlighting the connection between job resources such as co-worker support and work autonomy and a job demand such as a high patient to the nurse ratios and emotional demand. So they can cause a burnout and lower job satisfaction in nurses also. Cause consequently, and patient treatment is impact resulting in decreased safety and quality. So in additional, in under Donable's model of quality of care is proved that three main elements to determine its quality of care is include the structure, post-process and result. When it comes to the nurse staffing, the structure is represented by staffing number. So the process by nurse, care delivery and outcome by patient safety and care quality indicator. By enabling us to investigate which staffing or the structure also affect the care process and eventually patient outcome. The on is a quality framework with direct investigation. So we go to the methodology. Actually, this section is outline the design, setting, and process for conducting the study. Its impact of nurse staffing ratio on the patient safety and also care quality in a hospital setting. So this section actually ensure that the study design setting actually is supported and appropriate for the research question and objective, while also addressing key limitation and assumptions that could influence the study outcome. So now we go to the study design. In order to give a true grasp of how nurse staffing ratio affect patient safety and care quality, the study will use a mixed methods research design that incorporates both quantitative technique. This approach is suitable for the recording nurses staff complex experiences and opinion about the staffing level in addition to quantifiable result linked to the nurse and patient safety. So the study type is educative and collaboration with a quantitative component. As the additionally or data on nurse staffing ratio and patient outcome included patient medication mistake, fall and hospital economic infection and also patient satisfactions. So the sampling technique is hospital from various locations and content such as private versus the public and will be chosen using a stratified random sampling. This hospital have a variety of departments including surgical ward, emergency room, at ICU and more. It will be selected to supply a variety of information. In additional statistical technique like regression and correlation analysis are employed in data and to find connection between staffing ratio and patient's result. Additionally, the descriptive statistic will be used to gauge the distribution frequency of important variables. Okay, now next we go to the study setting. We say to capture the wide range of the healthcare setting, the study will be carried out in several hospitals in various locations, both urban and rural. This is to guarantee the result generability. The study will comprise teaching, hospital, community hospital, and both public and private institutions. Actually, to enable comparison between hospital with optimal and suboptimal staffing level, the chosen institution will have different staffing rules and ratios. So hospital selection criteria will be the first one. In order to guarantee the presence of multiple nursing units, hospital must have a minimum of 100 beds. So the secondly is data on a nurse satisfaction, patient outcome, and nurse satisfaction ratio must be readily available in hospital. Third one is a variety of nurse staffing model, including fixed staffing ratio and variable staffing model will be chosen from among hospitals. So the next one we go to continue about in the departmental focus is due to their high patient accuracy then important in comprehending how staffing ratio impact patient safety and service quality. The study will concentrate on ICU emergency department and also medical surgical wards. A source of the data, the hospital in the hospital record, information of nurse staffing level, clinical result, patient satisfaction survey, and also quality of care indicators including medication mistake and patient falls. So we go to the under interview and survey. The information gathered from the nursing staff members about the burnout, work satisfaction, and nurse staffing. In targeted and examination of the connection between nurse staffing ratio and outcome as well as nursing experiences is made possible by the department setting that were selected to support the study schools. So we go to the sampling process. Is to ensure the diversity and proper presentation across the important content and outcome. The study will employ convenient sampling for the patient and certificate random sample for nurses. So the sampling of nurses is to guarantee the sample include a range of hospital and nursing home with varying staffing level. Certified random sampling will be employed. So hospital will be divided into the different group according to their size, small, medium, and large, and whether they are private or public. This is to guarantee the nursing sample is diverse in terms of experience also. Shift pattern, educational background, nurses will be chosen at the random from different units within each stratum. So in the under the inclusion criteria for the nurses is our registered nurses who are employed at least part-time in hospital with available data on the staffing ratio, nurses working in the selection unit, the ICU, emergency, medical surgical ward during the study period. Nurses will be at least 1 year also at clinical experience in their current department to ensure familiarity with the staffing issue and their impact of care. So exclusion criteria for nurses who are not directly involved in patient care, such as the administrator and educators, nurses who are temporarily on leave or not available for this study, and nurses with fewer than 6 months of experience in their current units. So we go to continue in under patient sampling. So convenience sampling will be used to select patients who are admitted to the participating hospital during the study period. Usually this allowed to timely data collection across the diverse patient group within the selected department. So we go to the under inclusion criteria of patient, that patient age 18 and older who have been admitted to the ICU emergency or medical surgical ward during the study period, patient who is consented to participate in the study, patient who are too cognitively impaired to the participate are non-verbal are critically ill to the extent that information consent cannot be obtained. So this one is under exclusions. So while taking into the consideration the practicality of recruiting participate from these studies, with guarantee that both groups are suitability presented by employing sample for patient and certified sampling for nurses. So we go to data collection process. We use the NSSPS, actually is a nurse staffing patient safety survey. So the main tool of gathering information for the nursing professional will be purpose to evaluate nurses' opinion regarding staffing level, burnout, job satisfaction, and how staffing affect their capacity to provide high quality care. So both close-ended and Likert scale item are included in this survey. So the goal actually the collect self-reported information from nurses on how they feel about the patient safety and care quality, and also nurse staffing ratio. So there are 30 things in all broken down into the 4 area on the survey. So they have the nurses staffing envelope. We have the 10 item using the 5-point Likert scale, like 1 never, 5 always. Nurses are all asked to rate how frequently they are encounter certain staffing circumstance, such as uh, to few nurses or an inability to attend the patient immediately. So job satisfaction is we do have 5 items using a 5 Likert scale. Nurses indicated how satisfied they are with their workplace, including staffing, communication, and support. So using phrase I feel emotionally exhausted by my work, which are score on the being strongly disagree with and 5 being strongly agree with. So this 8 item test burn out and stress that according to the nurses experience. So you go to the effect of medical treatment, they will have the inside is 7 item rate statement, like I'm able to provide staffing inadequate, which are 5-point Likert scale is indicate how staffing ratios in the patient department care. So we go to patient outcome survey. The patient outcome actually collect data on patient safety and care quality also, and focusing on adverse event like a fall, medication error, hospital acquired infection, and also patient satisfaction. So the survey include 20 items divided into the 2 sections, and then also patient safety outcome the 10 item, and also patient satisfaction 10 item to make sure nurse staffing ratio and overall care quality. So we goes to the demographic questionnaire. So demonstrate if you gather basic from nurses and patients, including the age, gender, education, years of experience, and hospital stay lengths. The question will be allowed control over the variables. So we go to data collection method. Actually, we use a quantitative data on the nurses staffing and patient outcome to structure survey and hospital record. Nurses will complete the nurse staffing and patient survey, while patient outcome will be collected from hospital record, focusing on adverse event and patient satisfaction. So we go to the ethical consideration. The result will be adhered to the institutional review board ethical guideline with informed consent form provided to the all participant. Data will be encrypted and anonymized, and participant identities will be protected. So the nurse staffing in the patient safety survey, patient outcome survey also will be examined by subject matters aspect to ensure accuracy in the patient safety, nurse staffing, and care quality. Reliability tests will be performed on the survey, and a small sample of nurse will be administered twice to assess consistently over. So we go to the data analysis plans. So the quantitative component aim to examine the relation between nurse and staffing ratios and patient safety, care, and quality outcome using the statistical methods. The analysis will include a summary of that data. Correlation analysis to examine the strength and direction of the nurse relationship, and regression analysis to determine if nurse staffing ratio significantly predict a patient safety and outcome controlling for the others variables. So we go to the result. Under quantitative result of the statistical analysis of information gathered from patient outcome metric, nurse questionnaire, and hospital record are present in this section. Their finding is under characteristic data in the 520 nurses and 730 patients from 12 hospitals, 6 public and 6 private, representing both urban and rural areas took part. So public hospitals have an average nurse to patient ratio of 1:7, and private medical facility 1:4. So 8.4 years on average of the nursing experience. 3.9 out of 5 is the average patient satisfaction score. On the NSSPS scale, the mean burnout score is a 3.6 over the 5, which is moderate to high. So analysis of correlation is a co- 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 coefficients of variable pair correlations, medication mistake, and the nurse ratio of the nurse to the staff 0.48 below is 0.001. So we goes to patient fall and the nurse staffing ratio is at 0.42, uh, lower than 0.001. The ratio of the nurses to hospital acquired illness 0.36, below also in zero point zero 0.01. Patient satisfaction and nurse staffing ratio negative 0.51, job satisfaction and burnout negative 0.6. Interpatient adverse event and patient satisfaction are inversely connected with higher nurse to patient ratio, so reduced job satisfaction is correlated with increase. So conclusion, this study actually examined the relationship between nurse to patient and ratio and patient outcome in hospital. It found a strong correlation between inadequate staffing and negative patient outcome, such as medication error, infection, and dissatisfaction. Poor staffing also lead to the nurse burnout, reduced job satisfaction, and increased turnover. The study used a mixed method approach to understand the impact of the staffing model of the healthcare system, using theoretical frameworks like the job demand resources model and Donald's model of the quality of care. So this one is a references that I've gone through. It has total is 17 from on the proposal research. So thank you for the listening. Uh, so we can end on my presentation. So any question you all able to give feedback to me, and I would like to explain it by one by one. Thank you for the listening.